Silent heart attack warning signs you should never ignore. Heart attacks are often depicted in media with dramatic symptoms: clutching the chest, sudden shortness of breath, and intense pain radiating down the left arm. However, not all heart attacks fit this stereotype. Some occur silently, with subtle or even no symptoms at all. Known as silent heart attacks, these stealthy events can be just as dangerous as their more overt counterparts, if not more so, because they often go unnoticed and untreated. Understanding the warning signs of a silent heart attack is crucial for early detection and prevention of potentially fatal consequences. Today, we're diving into an important topic that could save lives: silent heart attack warning signs. But before we get started, don't forget to subscribe to our channel and hit that notification bell so you never missed out on our life-saving content. What is a silent heart attack? A silent heart attack, also called a silent myocardial infarction, SMI, lacks the dramatic symptoms typically associated with a heart attack. Unlike a traditional heart attack, which presents with chest pain and discomfort, a silent heart attack may occur with mild symptoms or none at all. Consequently, individuals experiencing a silent heart attack might not realize they've had one until complications arise or it's detected during medical tests. Risk factors for silent heart attacks. Certain factors increase the risk of experiencing a silent heart attack. Diabetes. Individuals with diabetes are more likely to have nerve damage that can mask the symptoms of a heart attack. Age. Older adults, especially those above 65 years, are at higher risk of silent heart attacks. High blood pressure. Uncontrolled hypertension can damage blood vessels and increase the risk of heart attacks, silent or otherwise. High cholesterol levels. Elevated cholesterol levels contribute to plaque buildup in arteries, increasing the risk of heart attacks. Smoking. Tobacco use significantly raises the risk of heart disease and heart attacks. Obesity. Being overweight or obese puts extra strain on the heart and is a major risk factor for cardiovascular problems. Symptoms of a silent heart attack. Just as no two hearts beat the same, no two heart attacks are the same, even for the same person. It is different for everyone, and the warning signs someone experiences before a heart attack can vary drastically from person to person. Heart attacks happen when one or more of the coronary arteries, which supply blood to your heart, become blocked. This means blood and oxygen can't reach the heart and causes damage to the heart muscle. Chest discomfort or pain, also known as angina, is the most common warning sign of a heart attack. It can feel like uncomfortable pressure, aching, numbness, squeezing, or fullness in your chest. Many people are familiar with this warning sign, as it's the classic sign often depicted on TV or in the movies. Sometimes people describe the pain or discomfort as an elephant sitting on my chest. It can spread to your arms, neck, jaw, or back, lasting for several minutes or coming and going in waves. However, it is important to remember that in some people, a life-threatening heart attack can start slowly with only mild pain or discomfort. In other cases, people might not get any chest pain at all. Did you know there are some less obvious and less common warning signs that people might experience before a heart attack? Here are 5 that you might not expect. Number 1. Chest pain, pressure, fullness, or discomfort. Sometimes the pain from a heart attack is sudden and intense, which makes them easy to recognize and get help. But what about when it's not? Most heart attacks actually involve only mild pain or discomfort in the center of your chest. You may also feel pressure, squeezing, or fullness. These symptoms usually start slowly, and they may go away and come back. This can be complicated because these symptoms may be related to something less serious, such as heartburn. You know your body best, though. If you feel like something's not right, you need to be evaluated by a physician or even head to the emergency room. Number 2. Discomfort in other areas of your body. A heart attack doesn't just affect your heart, you can actually feel the effects throughout your whole body. But this can make identifying a heart attack confusing. You may experience pain or discomfort in your arms, one or both of them, back, neck, jaw, stomach. These symptoms can vary from person to person. For example, some people describe their back pain from a heart attack as feeling like a rope being tied around them. You may also feel a heavy pressure on your back. Either way, if you think you're experiencing any of these less obvious signs of a heart attack, don't ignore them. Number 3. Difficulty breathing and dizziness. If you feel like you've just run a marathon but you only walked up the stairs, that might be a sign your heart isn't able to pump blood to the rest of your body. Shortness of breath can occur with or without chest pain, and it's a common sign of a silent heart attack. You may also feel dizzy or lightheaded, and it's possible you could faint. Though this can happen to both men and women, it's more common for women to experience shortness of breath. If you're having trouble with tasks that weren't previously difficult, such as making the bed or walking the dog, make sure you get it checked out in case it's a subtle sign of a heart attack. Number 4. Nausea and cold sweats. Waking up in a cold sweat, feeling nauseated, and vomiting may be symptoms of the flu, but they can also be signs of a silent heart attack. You may know what the flu feels like because you've had one before, but when your gut is telling you that these flu-like symptoms are something more serious, listen. Don't chalk these symptoms up to the flu, stress, or simply feeling under the weather. They may be much more serious than that. Number 5. No warning signs at all. Finally, it is entirely possible to experience a silent heart attack where you might not have any symptoms at all. In this case, your heart attack might not be picked up until later down the track. It is possible to experience several of these symptoms or just one. They usually last for at least 10 minutes and may come on suddenly or get worse as time passes. And did you know women are more likely than men to suffer from the non-chest pain symptoms listed above, along with feeling fatigued or tired? Read more about specific warning signs and risk factors for women. Here are some heart-healthy tips to reduce the likelihood of a heart attack. Be smoke-free. Do regular exercise. Eat a heart-healthy diet. Maintain a healthy body weight. Reduce your alcohol intake. Look after your mental health. Manage high blood pressure and cholesterol. For people with diabetes, manage blood sugar levels. The importance of early detection. Detecting a silent heart attack early is crucial for preventing further damage to the heart muscle and reducing the risk of complications like heart failure. Since symptoms may be subtle, it's essential to stay vigilant, especially if you have risk factors for heart disease. Regular checkups and monitoring of blood pressure, cholesterol levels, and blood sugar are vital for early detection. And that wraps up today's video. Remember, recognizing the signs of a silent heart attack could be crucial. If you found this video helpful, give it a thumbs up and share it with your loved ones. Stay tuned for more health tips and advice on our channel. Until next time, take care of your heart and stay healthy.